Across the world, in every country, there are people who turn to the United States as an international power and protector.
The 10,000th Syrian refugee is about to land in the U.S. today.
The country is seen as a beacon of foreign aid, a ray of hope in dark times when one's own country cannot provide for them. This support is life-saving for some. But for the millions of women that are affected by United States overseas healthcare funding, the overreaching power that the U.S. has in their everyday lives can have disastrous and sometimes deadly consequences. Under a widely unknown policy recently implemented by the Trump administration, women all across the world can be denied health care because of anti-abortion sentiments present in the United States.
The president, it's no secret, has made it very clear that he's a pro-life president.
As I am sure you know, I've also reinstated the Mexico City policy, first put into place by Ronald Reagan to protect the unborn.
Ronald Reagan's policy stated that if any clinic that receives U.S. aid also uses privately raised money to advocate, perform, or speak about abortion, then that clinic would lose their U.S. family planning funding. This policy is formally known as the Mexico City policy, but is known by its opponents as the Global Gag Rule.
The Global Gag Rule is a policy that is putting restrictions on service providers in the developing world. That means clinics and nonprofit organizations that are working in those countries, and it restricts them in how they use their own funding for services for women.
Supporters of this policy feel that there is a need to protect American taxpayer money from funding abortions abroad.
So the important principle that the administration is taking with this policy is to ensure that no federal monies are going to support in any way, directly or indirectly, the provision of abortion services abroad.
There's a misunderstanding about the way U.S. global health assistance works. There's a perception amongst Republican presidential candidates when they come into office that they need to put this rule in place to ensure that U.S. taxpayer funding isn't used to pay for abortions, when that's not how U.S. funding works to begin with.
There is already legislation in place which prohibits taxpayer dollars from being spent on abortions. In 1973, the Helms Amendment was introduced, which stated that no foreign assistance funds may be used to pay for the performance of abortions as a method of family planning or to motivate or coerce any person to practice abortions. But the Global Gag Rule does something different.
This restriction places a prohibition on providers' privately raised funding and tells them what they can and cannot do with their private funding if they want to receive U.S. global health funding. When the Trump administration put this policy in place, they massively expanded it.
Organizations that would have previously just lost their family planning funds will now lose all of their U.S. funding.
So it affects vaccines, it affects HIV treatment, it affects child survival. So it has a much more broader impact under the Trump administration.
Not only will this policy have a negative impact on other aspects of global health, but it also has the opposite of its intended effect. According to data from the World Health Organization, after President George W. Bush reinstated the policy in 2001, the number of abortions in sub-Saharan African countries increased drastically.
A policy that's supposed to result in a reduction in the number of abortions is actually going to increase the number of abortions.
This administration refers to it as protecting life and global health assistance. Unfortunately, we know that that's actually not what the policy does. In reality, it actually endangers the lives of women around the world.
According to Marie Stopes International, this policy, this expansion of that global gag rule, will result in 6.5 million unintended pregnancies, 2.2 million abortions from the lack of family planning resources, 2.1 million unsafe abortions, and 21,700 maternal deaths. That's just one organization that has historically worked with us in terms of funding for health care.
Many politicians are unaware of the full effects of this policy.
How do you see following up to address what's happening to the most vulnerable people around the world because of this policy?
It's largely been outside my arena of responsibility. I need to be better educated about that.
The impact that the policy has coming from the United States is far above and beyond what we would see if a similar policy was put in place by another country. So I think it's definitely something that we as Americans have a responsibility to address.
America needs to understand that our decisions create international ripple effects, that other countries turn to us as global leaders, and that every single decision that our leaders make shapes the future. Living in the most powerful country in the world gives Americans the responsibility to focus not only on the success of their own country, but on the well-being of people in countries less fortunate than their own, even in the face of contradicting moral values. America is standing at the podium of the global stage and must use this opportunity not only to better their own country, but to better the world.